So here we are at the intersection, and hopefully there's no ice out there at the intersections, but we've made it through. I hope everybody made it through the last couple days. I have run into some people without electricity along the way. I hope everybody here was kept nice and warm. And Jane, I love your icon. So, oh, so you.
I found it at the start of the pandemic, and no one said anything that's derogatory. Everyone enjoys it. So I'm like, okay, no need for my picture, just this image.
Yeah, it's a good one.
Thank you.
It's a good one. So you, right? So we are going to wait a few minutes and take any announcements that we might have. And I was already talking to Doug, and I've been sending it out with e-notifications about the upcoming event, Love Should Not Hurt, in our Faith and Family Homes. It's on Valentine's Day, intentionally, 8:30 to 11:30 at Tri-Point, which is at St. Mary's and 281. The doors will open at 8. We will have some very light refreshments. We're not serving like breakfast. I know but we're scrounging it together, right? But there will be some light refreshments and coffee and things. But we are going to be hearing some stories. A mother who lost her daughter to domestic violence. We'll also hear from a pastor and how he engages that conversation on a congregational level. But we'll also be hearing from folks from the Battered Women's Shelter, from the Peace Initiative on the basics of domestic violence. Chief McManus will be there to talk about the Victim Services Unit. So it is about putting into some more action this need where 1 in 3 women in all of our congregations, all around us, all the organizations, 1 in 3 women are suffering from domestic violence, 1 in 7 men. And in all of those cases, all the children who are involved. So we've been a little more silent than we should be as a faith community. City councilman almost a year and a half ago now, I think, really called us to task about where is the faith community and the horrendous acts that have been happening. Domestic violence has really shot up during the pandemic and really hasn't gone down any. So that's happening on Valentine's Day, 8:30 to 11:30, Tri-Point. And hopefully somebody in here, or I will put that link in. But I have been sending it out, and I will send it out again with next week's notification. So I'll keep sending it. Are there any other announcements, upcoming things we should know about? Give a couple more minutes. We're a silent bunch today.
And the executive book review tomorrow is doing a book called The Boy Who Was Raised as a Dog. It's a psychiatrist's notes on how to provide healing for those who endured trauma. And obviously some children were treated like a dog and in a bad way. So that's tomorrow, both in person on Zoom. If you're interested, go to executivebookreview.com. Thank you.
Great. You might want to, and you probably will, put that in chat too a little bit later when more people are with us. Anyone else out there? An announcement? One more.
Mark, what time does the book review start?
A little after 8 a.m.
Thank you.
And I failed to mention that Wednesday next week we're doing Richard Rohr's book, Falling Upward, has to do with aging with grace.
Never a bad thing to, do a book review on Richard Rohr. All right, it's 8:05.
I have a quick announcement.
Okay,
sorry.
Lisa.
Oh, sorry. So We've been working on getting a security grant in Texas to extend the National Security Grant Program for nonprofits and churches, synagogues, and mosques. And some of you may have applied for it and know about it, but I'll put my email in the chat. We really need some interfaith support to get the grant. So I'll tell you more about it if you email me.
Great. It's good to hear that you're working at getting that grant, because I've also been trying to encourage others to do likewise. I mean, that's available, and so I'm glad you're doing that. Keep us posted on how that goes too, and how we can continue to support, get people involved. All right, it's 8:05. And Erica's already working it. She's putting in there how to contact her before she even starts. So I want to introduce you to my friend and colleague, Erica. And she's with Metro Health Violence Prevention. She's also been co-leading our Sane Society Collaborative that formed just 2 days after the Uvalde incident. And there are also folks in her division that participate in the domestic violence prevention via the Faith Community Collaborative. So Erica, and I would say all on her own, but I'll let her describe that, but was really pushed through this idea of forming a violence prevention plan across the city, much like we have done with housing or the sustainability, the environment, climate change. So I know I've been working in this particular peacemaking area for 3 decades now in San Antonio, and I am beyond excited that this is happening. So I just can't wait for the rest of you to hear. Erica's leading that, and she's going to tell us all about it and where she's going to need some help, and we'll step up and help her. So Erica, thank you for being with us this morning, and it's all yours.
Thank you so much, everybody. I apologize. You're going to hear like bits of coughing. The allergies are strong with me today. And there's a little Star Wars reference for the fans too. As Ann said, I'm the Violence Prevention Administrator at the Health Department. We call ourselves Metro Health. So that's a city department, but we also have jurisdiction for the county area, which is unusual for a city department. And that's just part of how our local laws work, is that our health department covers both of those jurisdictions. It gives me the opportunity to more boldly collaborate between city and county governments because of that. I joined this team in late April, so it's been about 9 months. And when I arrived, I was assessing kind of the landscape of what's going on in our area and what we need to do. I noted that there were some kind of frameworks and plans in place around domestic violence and a path where we can collaborate, but there was not something that guided us on other areas of violence. So that's what got me thinking about this. A few of you have heard this spiel dozens of times, and then others have not. So I apologize for the repeat. I have a few slides here, but I'm going to go very quickly through them because I know our time is short. I have the slides posted in the chat for you, as well as an email that you can reach out to if you're interested in getting involved in this. So let me get that going for you here. I started talking about the idea that we have a need for a cohesive strategy around violence prevention. And in 2019, the city of San Antonio developed a comprehensive domestic violence plan, which again was focused specifically on domestic violence and how city entities could work together and collaborate with nonprofits and the county. Violence prevention, the section that I oversee and supervise, kind of got launched right around the same time. We have over 100 positions, and since 2019, we've had $31 million in city and grant funds going through these program areas to support our community. Additionally, if you're paying attention to things that the police department is releasing yesterday, they spoke about their violent crime reduction plan to the city council. And that's going to be a focus on a law enforcement approach to reducing violent crime. And violent crime is considered sort of physical crimes against people. So anything that falls into that realm. So these are things that are happening and sort of going on in our community, but they're not really unified in any way, and there aren't necessarily connections between all of these things. So the reason I want to develop a violence prevention plan is to create a strategic direction for the city and county jurisdictions and everybody that's involved in between. We're going to develop a 5-year roadmap to address the priorities related to violence in our area and the causes of those issues. It's going to take a public health approach, which means we're going to be looking at upstream and downstream approaches. So not just responding to violence after it occurs, but figuring out how to stop violence before it occurs. We're going to have kind of a multi-layered strategy put together by taking that lens. We're going to look at some shared priorities that are common across the community and different entities, and then use evidence-based strategies that will allow all different organizations and agencies to come together and work in a common direction, allowing us to have greater impact. The timeline and process for developing this violence prevention plan has already kicked off, and that's why a few of you have heard about this already. I am working with a few partners and some other organizations as a coordinating team. We kind of put on paper that we're going to go through this process together. There's a deputy chief at the city police department, a board member at St. John Baptist Church, and a researcher at UTSA in the Department of Criminology and Criminal Justice. And together, the 4 of us are coordinating the process, but this is really intended to be a process that involves the community and stakeholders. So we're creating spaces throughout where people like yourselves can be involved, or any of the organizations you work with, or really residents in any way. So in January and February, we're getting community and stakeholder input as to the things that are important to them. We're going to be looking at data in our community regarding violence and identifying a few priority areas that we need to address in this strategic plan. We know we can't address everything. When we're trying to harness resources and really dig in to have a big impact on something, we need to focus on the things that we consider the most important right now. In March through September, we're going to be developing objectives, strategies, and measurement indicators. So that's the body of the strategic plan. In August, we'll get some community and stakeholder feedback on that draft. And then in November, we will publish and release the strategic plan. Some of you have heard of the Collaborative Commission on Domestic Violence, which was formed in 2019 through a special order by Judge Sakai in his former role at the time. And this organization is a city-county commission designed to bring together these government entities as well as community-based organizations to really break down the walls between different parts of the system that support people surviving domestic violence and figure out how to work together. This group works off of that original domestic violence plan created in 2019, and they're ready to do an update to that plan. So in the process of developing this greater violence prevention plan, we're going to develop an update on the domestic violence pathway. That way we can engage the community and stakeholders all at once and don't have to go through a couple of processes to do that. But this will give us an opportunity to update the focus and the process that this group wants to follow. I briefly mentioned, excuse me, the community input process. We're looking for community members to give us their input on what's important to them. And we're going to do that in a couple of ways. Working with community-based partner organizations like the ones you work with to really extend your reach to get that feedback from residents and the people you work with, and organizing some town halls or kind of really community conversations right in the community and organized by the faith community. These are going to be kind of more accessible and authentic ways for the community to give us feedback. we're looking for your feedback through this process as well. So part of what I'm bringing to you today is we can use your help. We want to hear from you about what's important to be included in the strategic plan, and we would like to partner with you and leverage your networks and your connections to be able to get that input. If I were to put on a traditional government type of town hall, yes, some people would participate, but not everybody feels they can speak freely or express themselves. And usually those scenarios are very inaccessible to a lot of different people. So my attempt here is to kind of develop a more grassroots approach to obtaining this information in a way that hopefully results in something more authentic and true to what people really think, and engages the faith community and other community organizations as part of that process. Because you are the organizations that are in touch with people, and you are right there next to people when they're experiencing things and understand what's going on in their lives. So that makes more sense than me functioning a government agency, going out and asking people to tell me what they want. Additionally, we're getting input from people who work in this field. And that includes folks like yourselves, people who work in community-based organizations that address violence. I'm also tapping into government workers in the city and the county to ask them what they think is important. How we're going to select these priorities is to look at the community response in terms of what people are interested in, the response from workers in this field, and hard data that we see in the community. For example, homicides indicate something about our community. What does our homicide data tell us we need to do? What does our domestic violence data tell us we need to do? So we're going to look at these kind of three sources of information, and we're going to use that to generate between 3 and 5 priority areas to be addressed in the violence prevention plan. And I'm pre-selecting domestic violence as one of those, because that's part of our effort to coordinate a little bit more cohesively across different entities. And we know that over the past few years, while a lot of work has gone on in domestic violence, we haven't made a major dent in that yet. The data is not looking extremely different because it takes 10, 20 years to have huge impacts. So we're starting to make a shift, but we've still got a lot of work to do in that area. So in developing the actual plan, as I talked about earlier, what we're going to do is develop a work group around each of those priority areas that result from looking at the data. And then we're going to recruit multi-sectoral participants. So people who represent community organizations, residents, city and county employees. All of this includes people working in the faith community. And we're going to allow people to sign up for the work group topic that makes the most sense to them. We're going to make sure we include some subject matter experts in that. And then each of the work groups are going to go through a process to develop objectives, strategies, and indicators of achievement. How do we know what it looks like when we're accomplishing something? So there are a couple ways to get involved, which I've mentioned already, but I want to make those avenues very clear for everybody. We want your input, and we want your help to get more community input. So that's one level. And the other is to ask you to potentially join the planning sessions. Now, you don't know yet what the focus areas are going to be for the strategic plan. So as soon as we hear what those are, find out what that is, I'm going to share that with folks. We're not going to do huge open meetings for the planning process because we need to make sure that we can be productive on a certain timeline. So we're going to try to strategically recruit folks to fill each of those work groups. But I do need to know if you're interested in that kind of thing. So you are welcome to contact me. The email is listed here on the slide. The slides are in the chat. And I put the actual email address in the chat for you as well. This goes to the health department. So we're checking that email address, and this is where you can ask more questions or talk about how you want to participate. A few organizations I'm already starting to work with are asking, what can I do to help get that community input? I'm putting some very simple toolkits together that give some examples of ways you can do that. Some are how to have a conversation with a group of people and pull that information out and package it in a way that we can examine it like data. And others are if you want to use your electronic or social platforms to collect surveys, or all different kinds of ways in between. So I'm working on that and should have something next week for that. But we're already in the throes of this information gathering phase, and we would love to get your help. So I'm going to stop there and let Ann steer us.
So if anybody, first of all, has questions for Erica, if you would use your little app at the bottom under more and raise your hand, that would be great. And we can hear from different people. And because this is a prime opportunity to find out more details. One of the things that I'm thinking, Erica, while listening to you, and I get real excited about it, but I can see kind of the evolutionary nature of the work that we're already doing. So, going back a bit from the city's vantage point, really wanting community input on efforts that are happening, in particular, wanting more of the faith community involved in the input, in the leadership. So again, going back a bit, now we have at the intersection, we have different collaboratives like the Sane Society Community Collaborative. But I can, and the domestic violence prevention, I can see both of those, just becoming an active part, not only of the strategic plan, but even like the reboot with the domestic violence task force. In that reboot, perhaps the collaborative we have going right now moves into that and takes a very active role within the larger picture. We've been kind of working through the primer, like getting our feet and understanding and getting more people involved. But can you see that happening that way too? Or these collaboratives go different directions? So
yeah, definitely. Part of a question, I think that I make assumptions that people know where I'm going with something in terms of developing a strategic plan. But then people have asked, well, what happens after the plan is developed, right? In my mind, the plan gives my team a roadmap, my staff of 100 people. We need to know where we need to be going, right? So that's the simplest version of that answer, is that helps Metro Health figure out what it's doing. With SAPD, we're figuring out how to collaborate between that law enforcement angle and the public health angle. Where do we overlap with each other and intersect? Where can we build on each other? And even just moving beyond that, nonprofit organizations, everybody has their mission, but if we can figure out the spots that we all are working in the same space, or we have an opportunity to work in the same space, that gets us going in the same direction. And then when we start to layer each other's efforts on top of each other, we have a bigger impact. Now, to carry those things forward, it means we have to generate partnerships and collaborations. And I'm hoping that I don't need to hope, because I know this naturally comes through this kind of process. And I've been through this before, and this is usually what results, is steering committees are developed. Or other types of more formalized partnerships are created. And certain entities will step up and say, I'm taking responsibility for this area. We'll lead that and we'll convene people to participate. So all of those things are going to kind of naturally come through in the planning process, where the planners, people involved in the planning, will end up saying, we need certain bodies to organize this. And then as we release the plan, and on the back end, Metro Health, and I'm working with the police department and the fire department to help us develop our own implementation plans in response to this bigger plan. So how's the city going to respond to this? How's the city going to do things to help contribute to this outcome? So those are all kind of pieces that happen after the actual planning process to figure out how we deliver on those things.
Mhm, mhm. So it really is a good dovetail. I mean,
Mhm.
it's like we're kind of preparing, and moving the same way, which just really, as we found with all collaborative work, it exponentially increases the impact that all of our efforts have. And Erica, I just have to tell everybody, but I think of, no, I'm not going to make a general statement. I will though say with Erica, in particular, how much you have picked up on this kind of relational collaboration kind of thing that we use. That doesn't always happen when you're used to working in kind of another model, right? More of a linear model as well, or what, it's a little messier, it's a lot of good conversation, but so many connections happen in that conversation. And everyone, Erica, as co-lead of the Sane Society Collaborative, I mean, I've heard you say it, how much you appreciate how this works. So there's something really important that you bring in your leadership, Erica, to moving this forward, because I know that this is where we're headed collectively, and I mean larger collectively, and really appreciate that. One thing, this is a sidebar to Billy. Billy, maybe you could open up Sacred where the recordings are for at the intersection, because people have been asking about the different collaboratives. And then in a minute, we'll bring that up on screen, because last summer, just this past summer, we had reports in by every collaborative. So there's a real good report for briefing on the Sane Society Collaborative. So those who are interested can go there and really kind of catch what it's about. There's also one on domestic violence. So in a minute, we'll look at that while Billy finds it. Others, thoughts, questions, insights that you might want to pass on to Erica already. Our sheepishly brother Rob Mueller is here. Do you have any thoughts or questions? I know that this is near and dear to your heart.
Yeah, I guess my big question is kind of differentiating between what the Sane Society Collaborative is doing and what this violent prevention plan is doing. I don't know enough about Sane Society to know, and I emailed you about both of them, so I already did that. But if you could help me understand what the differentiation is between the focus of those two efforts, that would be great.
Definitely. Now, this is my individual perspective, but I see the Sane Society as really a grassroots network driven from the faith community that is focused on partnering between individuals and organizations and bringing the thoughts together and the energy together so that we can collaborate where we can. And I'll be very honest, yes, I work for the government, but no, I am not from Texas, so I speak freely about Texas law and policy. In Texas, gun control is a hot issue, right? Along with other things related to violence. I will say, in my estimate, having formerly been a state of Texas employee, that the grassroots angle is the most likely way we are going to be able to have a big impact on things related to gun violence specifically. It's not going to come from government entities. It's going to have to come from the community. And that, I think, is an advantage to the Sane Society Collaborative and why it needs to be developed. Now, the violence prevention plan is strictly a process built in a certain part of time. It's just a bringing together of organizations through my office, just because I work at the health department and this is my work territory, where we're bringing folks together to make this plan. We'll monitor it long term, but we're looking for all different parts of the community to help us get it off the ground and complete the work inside it.
And I would add to that, Rob, those who are in the Sane Society, also pronounced SAN, like in San Antonio, Sane Society. So in that we have people from the faith community, social workers, Pax Christi, Metro Health, SAPD. We've also got somebody there from Homeland Security. I'm trying to think of, we've got a batch of people in there from different entities, but really looking at the community and crossing those sectors together. And that's why I'd also asked Erica if she could see that, also morphing in to that larger strategy. But when I look at it kind of the big picture, it's like we've been getting ready on a community level. We didn't know it at the time, but we've been getting ready at the community level to move into this prevention planning process on a larger scale. So we've been making ready, and which is very exciting. And there were people who came together 2 days after Uvalde and just said, we've got to do something as community to look forward. It does focus on, and I'm not going to get all of them, and Erica might help me, but 4 or 5 different areas of prevention, intervention, healing, education. There are like 5 different areas that the collaborative has been looking at. I thought it was helpful too, Erica, at the beginning, where you said that the police department are looking at a reduction plan, and that this one that you're talking about is a prevention plan. And the collaborative has been looking at it, of course, more holistically, especially moving towards that healing and restoration. But they all work together. They're all needed, So
one of the just recently, I've been working with both Texas Impact and Cops Metro Alliance on the gun violence question. I'm working with both of them. And some of the folks from Texas Impact went up for a Lutheran nod to you, and Lutheran conference, Ephesus conference. And one of the takeaways that they had from that was that underneath the gun violence thing is just the question of, is the issue of just a generally violent society, an increasingly violent society. And so I'm very excited to hear, and that needs to be addressed. If we're going to address the gun violence thing, we're going to have to address the piece below it, and not just that one. And so I'm very excited about both of those initiatives and would like to be a part of that in whatever way I can. So thanks.
We'll invite you. One of the things that in the last couple months, there's been all this huge research across the more recent years on happiness. There was research on that, and people kind of said, how can you research happiness? And the people who were doing that said, well, we research sickness and not being happy and being depressed. Why can't we research happiness, right? And I think out of that, and also grew the research on like compassion and finding that that's part of our DNA. Well, I don't know, a couple months ago, precisely what you're talking about, Rob, I'm like, what research has been done on violence? And there's a body of research that's happening right now, and there's something like 17 different data points. I can look it up again. It's not Stanford. I think it might be Berkeley, but on violence in particular. And I think it's really important that we look at that research to go precisely, Rob, what you're talking about. What is that all about in humans? Like why? What is that all about? So that's one thing that I've been just researching to get to the research, right? But the one I was looking at, it's just starting. It's just starting its process. So I'm looking forward to that. Other thoughts or comments, Rob?
Oh, sorry, just I'm dominating here. Are there any folks who are actually doing research in San Antonio on violence, gun violence, and violence generally? Do we know of anybody in any of our universities that are working on that directly?
UTSA has, I'm going to get the words out of order, a College of Community Health and Policy, something like that. Inside of that are their Department of Criminology and Criminal Justice and the Department of Public Health. And both of them are doing different kinds of work in that area. And That's part of why I recruited somebody from UTSA to participate in steering this process with me, is we wanted the eye of a researcher, and somebody with access to that information. I would say that probably locally, nobody's necessarily doing more multidimensional, holistic research on it. They're following certain theories and disciplines. But when we look at it all together, that is starting to put together a better picture.
Yeah, maybe we can pull something like that together, Erica, for at the intersection. Or that
the
research
process of-
component.
Yeah,
That would
scraping
be
some of
really
that
helpful.
together from everybody,
Mhm.
and we can share that when we've got it together.
Awesome. Awesome. Any other thoughts, questions? Billy, I want to ask you to pull up that. Martha Ann in particular has been putting all sorts of things in chat, so I hope everybody's reading chat. But Billy, could you pull up the page in Sacred on the recordings of intersection? Did I give you enough time, man?
Yep, can do. Got it up. Here we go.
And then put it on screen. Here we go. So for those who aren't even new with at the intersection, all of these have been recorded since last summer. And maybe scroll down. Let's see if we can find the one, Billy, on Sane Society. Should be, I'm thinking about September. And these are all about, 30, 40 minutes long. There's the Healing Collaborative. The mayor's one on his top 10 is good. Book review. Stop there. No, that's not it. Domestic violence prevention. No, I think Sane Society is the newest one. Scroll back. September 22. Let's see what it says. Yep, that's it. That's it. Sane Society. It's not entitled. It just says our newest collaborative. We might want to change that, but that's the Sane Society. And you can see that Metro Health, SAPD, of course, my office, Compassionate San Antonio, social workers, Pax Christi, Community of Churches for Social Action, Baptist Ministers Union. They're a part of that one. But for everybody listening and looking, that was the last collaborative briefing we had. So they go from, I think, about June through September. And so if you're curious about the collaboratives, you can just go through those. And if you're interested in being a part of any of them, just email me and I'll make sure you get connected, invited to whatever the next go round. Thanks, Billy. Anything else for the good of the world? Well, awesome. Thank you all for being with us today at the intersection. Next week is going to follow right on this wave. We're going to be hearing from the Domestic Violence Prevention via the Faith Community Collaborative. We're really trying to light the fire there because it needs to be lit. We're very, very quiet about it in the faith community, and we can have a conversation, but I think we probably know most of the reasons why. So I hope to see you next week at the intersection to hear more about that. I hope you sign up for the event on Valentine's Day on domestic violence. Erica will also be speaking then. So come. I think we recommend a donation, but it's basically at no cost. So we hope people show up. Thanks again. It's supposed to get a wee warmer today, and then I'd like the weather last night is like, it'll be 65 on Saturday or whatever. And I'm like, yeah, whatever. San Antonio, right? So I'm glad to see you all this morning, safe and warm. See you soon. Hope to see you next week. Take care. Thanks, Billy, for running this.